So, we are going to learn how to feel and turn on our transverse abdominis muscle. So, we're going to be thinking about, of course, our deep lower abs here. And first, I want you to start by laying on your back. And you definitely want to lift up your shirt so you can kind of observe your belly and see what exactly is going on. So, first things first, take your fingers and I want you to find your hip bones, the ones that stick out right in the front of the hip there. Those are called the ASIS, anterior superior iliac spine, but that's kind of an FYI. Now, I want you to allow your fingers to drop just inside of that hip bone there. And now that you've got your fingers in your reference point for this particular exercise, I want you to now allow your body to completely relax. So relax the abs, relax the pelvic floor, relax your glutes, your hip flexors. You should be fully relaxed in this position. Now that you're super relaxed, I want you to think about lifting your pelvic floor. So I want you to do a squeeze and a lift. Now, as you lift, you should start to feel a tiny bit of contraction and firmness under your finger. And remember that the first 30% of contraction with the pelvic floor muscle um, just comes from the pelvic floor working alone. And the other 70% is when those deep abdominal muscles take kind of help and assist and continue the rest of that contraction. So if you can only feel a small contraction, or maybe you can't feel any contraction under your fingers, maybe your pelvic floor is weak and you are unable to get past that 30% contraction there. So if you're in that category, unfortunately, you will not feel this. So you do have to work up on building your pelvic floor strength. So let's do this together. I want you to inhale, allow that belly to expand, your ribs to expand, and of course your pelvic floor to expand. And then on, of course, the exhale, I want you to lift the pelvic floor up, and you're going to be zipping up your abs with this because I want you to really feel those deep abdominal muscles contract. Now, remember those deep muscles that we spoke about, the transverse abdominis works to flatten the stomach. So you should see a, flattening effect occur as you are contracting. Now, make sure that this contraction is actually coming from the pelvic floor and not because you're tilting your pelvis or because you're squeezing your glutes. That is actually a cheat. So play around with the contraction and intensity and see what happens. Now, next, I just want to prove a point here and show you a comparison of what happens when we use our upper ab strength and it kind of overpowers the lower abs and what it does for the low body, like that mom pooch there. So while still laying down, I want you to squeeze those upper abs. You may even need to do a little baby crunch just to overemphasize, but see what happens to that low belly. Do you see that it starts to pooch and stick out? Now, when we do that, we push on our pelvic floor, and that's a form of bearing down. And that is what happens when we leak, and what happens when prolapse occurs, or this can also worsen a diastasis. So you're putting too much pressure on that pelvic floor and causing that bulge in the abdominals. So that is why crunches are not the safest exercise or the best way to deal with or fix that um, mom pooch that everyone talks about. So play around with this, and we definitely want to build strength in this area so that we can avoid that pressure downwards.